Thanks to Shirley Lynn and Stephanie Gorgakis Abbott of the Miller Center UVA. And thank you, Patricia Shelley, and congratulations to the Reform for Resilience Commission. I really did enjoy the Triple Challenge paper. I'm going to speak for a few minutes about the United States, but I'm also happy in the discussion to speak about low-income countries. Today, the Global Pandemic Monitoring Board came out with a very tough paper in the lead up to the World Health Assembly special session and the G20, really stark description of the status of low-income countries in Asia and Africa, in particular, what the future looks like for them. And I hope we can talk about that. But I'm going to talk right now about the United States, and I'll end with a little bit about the United States diplomatic strategy. But I thought I'd mostly concentrate on what's happened internally within the United States. We've had a very dark and profoundly difficult experience. We've had 45 million cases. We're still at 60,000 a day. That's down dramatically from the peak that we experienced in late summer here, which was about at the 250,000. We're still experiencing significant death levels. Over 1,100 a day. We're at about an aggregate of 735,000. We're heading towards 800,000 fairly rapidly. In terms of vaccination efforts, they moved very rapidly and then began to plateau, and now they're picking up again. We're at about at least those with at least one dose, almost 67%. And fully vaccinated, about 57%. And boosters are beginning. About 7% of U.S. population has already been boosted. We do have 64 million adults above 12 who are unvaccinated, and 48 million children that's still to be vaccinated. Now, my argument is really kind of twofold. One is I believe that there's reason for optimism and hope that the United States is turning a corner and laying the groundwork for resilience and moving with some deliberation to tackle the deep weaknesses and inequities and vulnerabilities in our public health system and our medical service delivery, and acquiring some confidence and commitment. And I'll explain what I mean by that. First of all, the forecasting that's been done recently is landing on high probability on a fairly positive estimate of what the United States is going to look like as we head into the late winter and early spring, early summer in the United States in 2022. Our vaccine coverage and infection-based immunity rates will continue to rise to pretty high levels. Our mandates, the President Biden turned to mandates on vaccines and other measures as a national policy, which are going to affect 80 to 100 million persons who are employed in the United States. Early evidence is showing those are being successful. Boosters are moving out very rapidly. Children are going to get vaccinated soon, and we'll begin to see antivirals become available. Extreme illness and death are gradually being removed pretty dramatically from the picture, and I think we can expect as we head into 2022 further progress there. We have systems in place to manage these matters that I've just mentioned. The COVID-19 task force remains a pretty powerful and well-organized effort. We have moved towards an industrial policy, a very strong industrial policy that began under the Operation Warp Speed and is being extended, making use of the Defense Production Act and other measures. And there's efforts underway right now to lay the groundwork for the future. The White House Office of Science and Technology Policy put together with the National Security Council a $65 billion plan for developing over the next 7 to 10 years a full spectrum of vaccine platforms as well as therapies and diagnostics. It's a very dramatic first cut at what's required. We may need more than that, but nonetheless, it's off to a good start in terms of deliberations with Congress and the like. Now, having said those things that lead people to feel reasonably optimistic about the United States going into 2022, there's also good reason to be fairly cautious, and that's because of uncertainty and continued politicization. we've already heard that what's happening outside the United States is particularly among the poorest countries in the world, as detailed in this dramatic new Global Pandemic Monitoring Board report, it's pretty bleak. And we have very strong possibilities of new variants coming forward in those areas where there's large populations with uncontrolled transmission. All aspects of the response in the United States have been exceptionally politicized. This is an extreme situation, and it is peculiar to America. And it's cleaved our society into really two partisan halves. That was completely avoidable, but that's the reality we face. And that is going to continue to be an impediment for us. Trust and confidence are at a very low point right now. Anti-science forces and misinformation and hesitancy, very significant factors. I want to emphasize that, 8 or 10 months ago, 39% of adult Americans fell into a movable middle. They fell into a category of people who were asking legitimate questions about vaccines, looking for answers, and delaying their decision around getting vaccinated. That movable middle has shrunk from 39% to 7%. But the percentage of hardcore refusal to get vaccines has remained quite high at 12 to 15%, depending on how this is estimated. Parents who've been polled about vaccinating their children, fully a third are saying they will refuse to vaccinate their children. The mandates that are being put in force here, where people are going to face the need to become vaccinated, in some instances, that or regular testing, otherwise lose their continuity of employment. We will see court challenges to those mandates. And we've seen a pretty dramatic erosion of morale and capacity in local public health authorities, the 3,500 local health authorities. What does this mean? In sum, what this means is that the United States societally really requires a long-term change in political culture if we're going to see the kind of enduring and sustainable changes that we need. We're making significant progress, but we're also profoundly divided. We have budget battles still fully upon us. The uncertainty around the infrastructure bill and the social safety net bill is going to have direct impact on prospects for funding some of these initiatives that I've mentioned. And obviously, the 2022 political cycle, if the House or Senate or both shift to Republican control, we could be back into a much more contested terrain in terms of what the future looks like. A few final words here on two other topics related to this. One is, should there be a national commission? That's a matter of active debate here in the United States. We had, after 9/11, the 9/11 Commission, directed by Philip Zelikow, was very successful and historic. There's a new effort underway to explore that, but it's difficult terrain. It's difficult to imagine getting a congressional authorization through on a bipartisan basis. And the Biden administration itself is being very cautious about this matter. That remains to be seen. In terms of U.S. global leadership, what we've seen most recently is the United States, President Biden stepping out and signaling a desire, after a delay, a desire to be much more engaged in bringing U.S. leadership to the table in the response for low and middle income countries in particular. We saw that in June at the G7, the president stepping forward and saying the United States would be the arsenal of the world, committing to the purchase of 500 million Pfizer doses to be donated through COVAX. We had more recently, the September 22nd, US organized global summit on the margins of the UN General Assembly. Again, the president stepped forward, made another commitment of 500 million Pfizer doses towards COVAX. The US contribution now, in terms of donations, at over 1.15 billion doses. That's significant. There were other things that were important in that September 22nd summit. There was a boost to the idea of a new financing mechanism for preparedness, a financial intermediation fund that will be debated out at the G20. It got a strong embrace from the EU, from Indonesia, India, and Vietnam and others. President of Italy embraced, of course, hosting the G20. So there's some hope that we will see some movement in such an entity being moved forward with a hoped for startup funding of $10 billion. We'll look to the G20 to see what happens there. Also, the G20 will be debating out whether there should be a new board, a global threats board of both finance and health ministers on that. We have to, however, be very realistic about U.S. leadership. It's been very ad hoc and fragmented. There's not a clear strategy or a clear executive structure for oversight and unity. It's often its leadership tends to be spread across different agencies, and that's a cause for concern. In terms of diplomacy and building alliances, this is not 2002 or 2003 when the Global Fund and the President's Emergency Plan for AIDS Relief were launched. This is a much more difficult environment in finding partners who are willing to come to the table with major new concrete commitments. The G7, the G20, we'll see what happens next weekend. The September 22nd COVID summit, there was very limited concrete commitments made in that period, and that's very telling. Much of the world is still in an emergency response phase right now. And the last point I make is that the U.S., the toxic escalating confrontation between the United States and China creates an enormous barrier in trying to bring about some kind of coordinated mobilization at a high diplomatic level. And that really is a significant barrier that did not exist in the early naught decade when the Global Fund and the President's Emergency Plan for AIDS Relief were launched. And that's something that has not been really dealt with. The other closing remark I'd make is that at the September 22nd summit, the private sector was invited to observe, but did not present. There's complexities in trying to do that, but there needs to be much greater engagement of the private sector and much greater transparency and accountability, particularly in the vaccine marketplace. And the EU and US have formed a task force on supply chains for both vaccines and therapies, and hopefully that will bring greater transparency and accountability, but that's been a huge problem up to now. Thank you so much.